Hi, Dr. Suleiman again. And what I wanted to do was to announce that we are starting to reopen our office for patients to be seen as needed. We, like everyone else, is very happy to the fact that we in Hawaii have now had a tremendous outbreak of the virus, that our infection rates and our hospitalizations have been minimal relative to some other places. And we understand that people want to return to normal, but we don't know what the real or the new normal is going to be. So we are starting in a stepwise fashion to come back into services in our office. We will continue to do telemedicine for many people, both because of the health risk, but also because in some people it gives them a convenience level of follow-up and reevaluation that is useful and essential in their daily schedules. We're also going to start to resume doing nighttime studies, the PSG, for those patients whose symptoms or other medical problems make it that is the best clinical test to do to determine if they have sleep apnea, but more, or as importantly, is it complicated by irregular heart rhythms, changes in blood pressure, other things that we just can't see, or do they need that kind of assessment to put them on the right therapy? Because some people need more adjustments in determining what treatment will work if they do have sleep apnea. If you go to our website, you will see that we kind of took some extra steps to sanitize our process. We not just washed and cleaned things as usual, but we've packaged things in plastic and covered our facilities. Our technicians are covered in protective gear, and we'll continue to do these kind of things as long as necessary to ensure for you as good an environment as we can have in terms of your safety. In addition, we will continue to ask you about your exposures. If you've had respiratory symptoms, if you have a fever, those situations where we would say, you know what, let's not do this now, let's wait and do it later. But those things being evaluated, for those patients, we are going to start doing the in-lab studies again. We will see patients in the office. Not everyone, again, and certainly some people, just because of their health risk, we will limit and postpone. So with that, we too want to start to participate in the return to a more normal process. But we, like you, all have to keep in mind that we've done nothing to control this virus. We've only lessened our exposure by our availability. And as we go back to being more available to other people, we still have to be very conscious of the recommendations to control and limit our exposure. But with that, hope to see you soon. If you've been referred to us or an older patient and need to return, as we make ourselves again more available in the office setting.